Today we're going to talk about the care home medicines optimization toolkit, which has been developed to support care home with their legislative requirements and optimize their use of medication. So just a bit of background quickly. UK has an aging population, which is likely to create an increased demand for care home in the future. And currently we have two-thirds of our care home residents have dementia, and our residents tend to be the older population with functional or cognitive impairment and taking multiple medications. So they are our high-risk patients who are more likely to suffer harm from medication-related incidences. So we need to ensure that care homes have good, robust policies in place. Also, we have younger people occupying care homes, and approximately 22% of people with learning disabilities live in care homes. In addition, we know that residents frequently transfer across other care settings, so we know that the risks associated with this as well. And also the literature then supports that medication errors in care homes are common, and not surprisingly because of the older population with known patient safety risks. We're looking at living with comorbidities, polypharmacy, dementia, lack of physical dexterity, and dysphagia. So it's important that we support care homes with their responsibility for medicines management, and they have, as I said, a legal responsibility to ensure that all aspects are covered with policies and procedures. So the aim of this toolkit then is to bring together a suite of guidance, documents, tools, and other resources to support care homes, and also healthcare professionals who provide advice and support to care homes. Naturally, in order for us to improve the use of medicines in care homes, there needs to be good collaboration across with other healthcare professionals, your GP practice and your pharmacy. So I've been asked to pick up a couple of areas to focus on within this toolkit. So we're going to look at homely remedies, when required medication, and COVID administration then. So homely remedies, they are over-the-counter products used for the short-term treatment of minor ailments. So thinking about things like indigestions, cough, mild pain, constipation, and other minor or self-limiting conditions. And these are the medication that can be obtained without a prescription to treat kind of common conditions where the person would normally wouldn't need to seek medical care or treatment. So in the care home environment then, so if a resident develop such minor illness that in their own homes would be easily treatable, maybe accessing a local pharmacy for over-the-counter products, care home staff have a recognised duty then to be able to also respond to these types of self-limiting conditions that are experienced by their residents. If this resident doesn't have access to such remedy, then the normal course of action would be to probably contact the GP or the out-of-hours service, which is not an appropriate use of NHS resources for something quite mild. So they can have a homely remedies policy within the care home and stock a range of over-the-counter medication, so they can support the immediate need of that resident, and then only contacting the prescriber then if symptoms persist. So if they agree to stock such product, they'll need to develop their own policies, and they could use the template provided in the AWMSG toolkit as a starter. So just an example here of what was included. So and this is to support care workers who obviously are clearly limited to making only supported decisions. So this homely remedies then provides a framework to allow administration of these medicines to all residents, but within a defined situation. And we can define then which patient group should or shouldn't be given a specific product. So it's useful for the GP practice then to know which stocks of homely remedies are available for residents, and it's also good for them to support the care home to develop the specific homely remedies policy, and also agree the duration of time that that specific homely remedy should be continued before the resident needs to be referred to the prescriber. So it's up to the manager of that care home to make sure their staff are supported with adequate training to utilise the policy, and also that all administration of remedies are recorded as on their MAR chart as per the medication there. So really, this is to support the care home, and once the policy is in existence, then the GP would need to be contacted to ask permission to start using the homely remedies. So then again, it's trying to allow the care home to treat and support the residents with some mild or self-limiting conditions. So there's a couple of examples within the toolkit, but also the GP may instruct a care home to purchase a specific over-the-counter product to treat another minor ailment that may not be included in the homely remedies, and this is no different to a person in their own home. What we'd recommend someone living in their own home to do as well. But we need to make sure that this is followed by ideally a written instruction then from the GP, so the care home can add this to the resident's individual care plan. Okay, next moving on to when required medications for prescription only medicines then. So care home providers must have a process for handling, administering when required medicines, and not just offering PRN medication during the standard meds ward round, administration ward round. So residents need to be able to access when required medicines outside those administration rounds, but we know that this doesn't always happen, and evidence shows that those who are unable to communicate are less likely to receive PRN medications, which they're the ones who probably need it the most. So we need to be supporting our care home staff to allow them to administer PRN medication appropriately. So we need to support them to be able to identify when the resident would need to take their PRN medicines, and this requires a good relationship then between the practice and to ensure that relevant information can be added to the care plan, as we've got non-clinical staff potentially administering the medication. So we need to provide relevant information around what the reasoning for administration, or what the reason is for administering the PRN medicines, how much to give. Variable doses is not always helpful. We need to specify how much they should be taking, and also providing as much information as we can. So not just adding to the affected eye for eye drops. That's not always helpful, particularly when you've got staff turnover. And also provide information around the minimum time between doses, and also details on when they may wish to contact the prescriber if there's no improvement. So the key ask then is to make sure that we include as much information as we can on that prescription when it comes to PRN medicines. So this can be added to the dispensing label and then onto the medicines administration chart. And finally, a little bit about covert administration. So the care home should have process in place for the administration of medicines via covertly. And that's to protect the resident, obviously receiving the medicines, but also to protect the care home staff involved in the administration process. So when we're talking about covert administration, it's a term we use for medicines that are administered in disguised form without the knowledge or consent of the resident receiving them. So, for example, when we add medicines to food or drinks, and this is separate to the management of, when we've got acute confusional states like delirium caused by something like an infection. Those are separate to the need for covert administration. So if the resident lacks capacity, then there should be a best interest meeting involving the people who understand the residents. So There's obviously be the care home staff, relevant health professionals. We need a medication review to ensure that whether the medicines are still appropriate and needed. Pharmacists would be useful to advise how best to administer that medication covertly. But also we need people who can communicate the views and interests of the residents, whether that's a family member, independent advocate, or if it's an attorney appointed by the Mental Capacity Act. And obviously should never be used for residents who have capacity to make decisions about their medicines. So if a decision of the best interest meeting is that it is in the best interest of the residents for the medicines to be administered covertly, then a management plan should be agreed, and this would include clear documentation then on the decision of the best interest meeting and a plan to review the need to continue this way of administering the medication on a regular basis. And medicines shouldn't be administered covertly until a best interest meeting has been held. However, if it is like an urgent situation, it is acceptable for a less formal discussion to occur between the care home staff and the family and maybe the prescriber in order to make more urgent decisions. However, this should be followed by a formal meeting as soon as possible. So care homes should consider having a wider policy around COVID administration across, for example, organisational boundaries, and should be developed and agreed by the relevant care and social care and health practitioners. So we'd be including the GP practice in this, so we could agree the wider policy around COVID administration. And finally, he asked for then around this toolkit is just making care homes aware of this as a resource. So bringing it to the attention of your care homes, and also trying to improve the organizational governance across the pathway for care home residents. And one way of doing this is to ensure we identify roles within the practice, so those having a nominated person to deal with care home prescription requests, and similarly within the care home having a nominated person and a deputy then to support with the ordering process to make sure we get things done as smoothly as possible. Brilliant. Thanks very much for your time.